So what does it mean to have an Lsil HPV positive pap smear? The fancy medical term for it is a low-grade squamous intraepithelial lesion, so much easier just to say Lsil. And HPV is referring to human papilloma virus. So this is an abnormal pap smear, and depending on your age, you may need further testing and evaluation. When we do pap smears, it's a screening for cervical cancer. So think of it as like different tiers of what can happen. So think of it almost like a stepwise approach. So on the very bottom, you have your normal negative pap smears. Then you're gonna have slightly abnormal, like an ascus pap. I can make a different video on that. Then you have Lsil or low grade, HSIL high grade. There are also a ton of other results you can get on a pap smear, but ask me about it and I can reply in the comments. So negative, ascus, low grade, high grade cancer. Kind of think of it in that way, almost like a staircase. So Lsil is low grade, meaning when we did your pap smears and we looked at the cells, they look slightly abnormal. And then when you are looking at the cells, you can also test them for the presence of HPV, because we know that the majority of causes for cervical cancer is due to HPV virus. If you're over the age of 25 and you have an Lsil pap that's also HPV negative, we recommend that you get a colposcopy done. And a colposcopy is another exam procedure where we can actually really look at your cervix and see if there's any abnormal cells that we can see with our eyes, and with the use of a colposcope, which magnifies everything. If you're younger than 25, like between the ages of 21 and 24, we typically just repeat your pap smear in a year, because we know that the younger you are, the higher the chance of your own body killing off and clearing that infection with the HPV, and then like your pap going back to normal. Now say you have an Lsil pap and you didn't follow up. You didn't get a colposcopy, you just kind of switched doctors, you moved, you forgot, like something happened in your life where you didn't follow up. Why does this matter and why is this dangerous? So remember in the beginning when I mentioned that like staircase of like negative to kind of abnormal, low grade, high grade cancer? If you're sitting at that low grade and say you're 35 years old and they found that, and you do nothing, and then 5 years, 10 years go by, those abnormal cells will then jump up to high grade, and then they can jump back up and go into cervical cancer. So the reason we really want to do pap smears and why we recommend the screening that we do is so that doesn't happen, so that we catch that infection